So Sam, you and your son Shane are part of the Preparing for Adulthood cohort in Greenwich. Would you like to tell us something about Shane and your family and what you've been up to?
Yeah. Shane is 14 years of age. He attends Charlton Park Academy. He's a great lad. He's funny, he's affectionate. Shane has complex needs, and the school he attends is a special school. And when we were invited to be part of this, I think it's a great opportunity to trial out something new. We really embraced the opportunity.
You were already coming towards Shane's transition years when the whole Pathfinder started. So how did you find out about the Pathfinder?
Well, as Shane was approaching 14, I began to get a little bit concerned about his transition review, which was coming up. I knew it was a really important review for us to really be thinking about Shane's future. And what I really wanted was for everybody who was involved in that planning to understand Shane as a person, to understand our family, things that were important to Shane, and to really focus on trying to give Shane the opportunities to live the life that was most important to him. And I was a little bit worried that, you know, just being with professionals and looking at pieces of paper and talking about his disabilities and all the things he can't do, we would lose the focus on Shane as a person. I got involved with the RIC Centre a couple of years ago and learned all about new ways of working through technology, and I developed a wiki for Shane. A wiki is just an easy read multimedia website where we could keep lots of photos and video clips about Shane and focus on everything around Shane's life, his school life, how he communicates, and also not forgetting, you know, it also is important for us to remember that he does need support with various aspects of his life. So when we had Shane's transition review, we were able to show all this footage, and it was really wonderful because Shane was able to participate and show part of the wiki as well. And it was a really special moment for us because it was the first time Shane actually participated in a review, and that was a really, really positive experience, not just for us as a family, but really the feedback from all the professionals who attended felt they got a really good picture of Shane and his life and him as a person, and not just his difficulties.
So you've been using all of that information and those experiences to develop Shane's single plan?
Well, I felt the work that was done around his transition, because I felt his transition review was really, really person-centred, and everyone got a really good insight into what was important for us. It was almost like a natural progression, the single plan. It was like a stepping stone from his transition review. And professionals who were involved with Shane, as I believe they started to change their way of thinking and become more person-centred, it was a natural progression for them doing the work around the single plan. And I think it's really beneficial being able to bring together the health element and the social care element. And I feel and I hope it's going to mean that we're going to have a lot less assessments in the future, and everything will be done in one place.
So in developing Shane's single plan and building on the wiki, what do you feel is going to be the main difference with the reforms from how the system was before?
I think the main fundamental difference is going to be about what's important to Shane and us as a family, as opposed to what's available. I think it's going to create opportunities for people to really think outside the box and to focus on, you know, what are we trying to achieve? What is the life that, you know, we as a family want for our son, and how can everybody together, you know, build on their experiences, build on their knowledge, and come up with creative ways to help Shane live the life that he wants to live.
I had the privilege of being at Shane's Year 9 review, and for me what was really powerful was him contributing, and by developing the wiki it seemed as if he'd really got to know that, and it was his family, and he got really excited about it. So him being part of the planning seemed to me to be a really big difference.
It was huge. You know, I must admit there wasn't a dry eye in the room at the end of the review. When we developed the wiki, my aim was to share Shane's life with everybody. And when I told my husband, actually, you know, I'm going to teach Shane to operate the wiki with my support, so he could possibly attend the review. And to be honest, my husband was quite apprehensive. We didn't know how he would react to listening to himself, having fun and doing the things he enjoys doing. And it had the opposite effect. It's almost like now helping Shane have memories, you know, because of his visual impairment, he's unable to, you know, look at photos and things, but by actually listening to himself in various environments, he's reliving that. And it was really, really clear at the review, you know, his reaction to the various activities, and everyone around got a really, you know, solid idea of what he enjoys doing, and to actually see his reaction it was really special.
It was. You've obviously got high aspirations for Shane. Can you tell us what they are and what you'd like to see him doing when he's 21?
When Shane's 21, actually, being a mum of 2 children, one with a disability, one without a disability, my aspirations are the same. I want them to, both my children, to wherever they live, to be surrounded by people who love and care for them. I want Shane to go to college. I would like him to be able to go to his local college and also have friendships and to be given the support so he can continue with those friendships right the way into adulthood. And I'd like him to be as independent as possible and be given the opportunity to learn as many skills to help him to reach that independence.
Thank you very much.